My name is Deirdre, and the topic of my teaching presentation today will be removal of the indwelling Foley catheter. An indwelling urinary, also known as Foley catheter, should be removed when bladder decompression is no longer necessary, when the patient can resume voiding on their own, such as 48 hours post-surgical, or when the catheter is obstructed. The need for the catheter should be reviewed daily by the nurse and the physician and removed as soon as need for its use can no longer be clinically indicated. This will help to prevent catheter-associated urinary tract infections, or CAUTI as they are known. CAUTI is a hospital-acquired condition with payment implications because it can be reasonably prevented using best practices. Be sure to follow CAUTI prevention practices such as performing hand hygiene prior and after Foley manipulation, maintaining a sterile, continuously closed drainage system, maintaining unobstructed urine flow, and emptying of the collection bag and discontinuation of the catheter as soon as it is no longer clinically indicated. The procedure for removing the catheter starts out with gathering your equipment, which includes gloves, a 10 ml syringe, and a fluid impermeable pad to put under the patient. Today we have a pediatric patient in lieu of an adult subject, so we'll just pretend this is an adult. After we've gathered our equipment, we've performed proper hand hygiene, put on our gloves. We're now going to confirm the correct patient's identity by checking two modifiers. We will ask the patient for their name and date of birth, check this against their wristband. We have previously verified the doctor's order for discontinuation of the Foley, as a doctor's order is necessary to take the Foley out. After this, you explain the procedure to the patient. Ms. Smith, today I'm going to be removing this Foley catheter, this tube that's going up into your bladder to drain the urine out. It's a relatively short, painless procedure. I need for you to inhale deeply and then let your breath out. Upon exhalation, I shall be removing the tube. Okay, now we take our 10 ml syringe after we place the pad under the patient in case there's any spillage of urine. Take your 10 ml syringe, hook it onto the lure lock mechanism of the Foley tubing, screw it on. We'll be withdrawing 10 mLs of fluid to deflate the balloon, as 10 mLs was necessary to inflate the balloon when the Foley was inserted. Okay, Ms. Smith, take a slow, deep breath in. Now exhale it. As the patient exhales, you will pull the tubing. Be sure and hold that end up high to avoid any splash or leakage. Gather up your trash. Dispose of in the proper receptacle. Now we'll take off our gloves in this manner. Ball up this one, put it in the palm of this hand, taking this one off, covering over it, also disposing of the glove. Patient teaching includes informing the patient that he or she may develop some urinary incontinence, urgency, frequency, dysuria, discomfort, or urinary retention after the Foley has been removed. Please notify me if any of these symptoms happen. Documentation includes time and date of the Foley removal, amount of urine in the Foley bag, carefully noting the color, any odor that the urine may have, and whether it may be cloudy, clear. We also want to note the time and amount of the patient's first void post-catheter removal, and my interventions that may have been taken, my response, the patient's response to any interventions I may have been taking. And that's it for Foley catheter removal. Thank you.